that perhaps all of you would be interested in. So let's welcome Rezvan Arabzadeh. Rezvan, how are you today?
I'm fine, thanks. How are you? How are
Yeah, I'm
things with
good. Thank
you?
you very much. So, Rizwan, can you please give a brief introduction about yourself and your skills to our audience who are watching us today?
Okay, thank you. But I think you said all. I am Rezvan Arabzadeh from Iran. I am a master student of clinical psychology, and my bachelor was in general psychology. I'm specialized in hypnotherapy and so many like EMDR and family therapy and so many things like that in therapy. And I have some education in hospitals because of my major that is clinical and some it's like my journey. It was in hospitals and clinics so far, and, and I'm happy to see you here. I'm interested in health psychology. I do love to coaching, and I coach and enhanced memory. I was coach as an enhanced memory coach and speed reading. So about 3 years I work on this subject. But here we are going to speak on hypnotherapy, which is my favorite part, and I really work on that.
Okay, great,
I
great,
really work on it. Yeah.
great. Thanks for the detailed introduction, Rizwan. So, let's just start with the basics. Okay. Like in general, what is hypnotherapy? Because people see a
Yeah.
lot of movies and they have some misconceptions about hypnosis. It's good, it's bad. So tell us like what's
Yeah.
hypnotherapy and how it can be used for
Okay.
people.
Let's just keep it simple. When we combine hypnosis with therapy, it means we are going to healing something through hypnosis. So when we say hypnotherapy, it's about therapy of something with hypnosis. But when we say hypnotism or hypnosis, it is about just doing hypnosis for no reason, just maybe for imagine something and suggest from something. But when we have therapy, it's for healing something. But what is hypnosis? In Persian we call it hypnotism, and in English it should be hypnosis. It's something different in
Mhm.
that. What is hypnosis? It's when you are these three: suggestible, dissociation from the environment and things, and absorption. When you absorb things, it means you are in a state of hypnosis. So, three, when you are in a suggestible state, dissociation, and absorption. It means this is hypnotism. So, with this, we can say every day we have this experience through our life. When we listen to a song, when we watch a movie, when we even drive.
Mhm.
Sometimes our body is somewhere, but our mind is in another place. So
Okay.
we can call it we are in a stage of hypnosis.
Okay. And I
Yeah.
mean, like, that's something that you have explained very well, I would say. That you told us the basics of it, that you're in
Yeah.
association, you're in a suggestive state and all. So that's quite, informative and you simplified it very well. So, I mean, like, is hypnotherapy safe? People always ask this
So,
question, do we depend on someone always for hypnotherapy? Is it safe
uh,
for us? Should we go, yes or no? So how would you advise about it?
okay, you asked about is it safe or not, but there is several misconceptions about hypnosis that we should talk about it.
Mhm.
Is it okay to speak on all of them or just talk on is it safe or not?
Well,
Is it yes
well,
or no question?
well, you can just give a brief answer for that.
Okay, just a brief answer. If you need a brief answer, I should say it is safe, but it is good to do it with a professional hypnotherapist, not with an unsafe person. It is safe
Hmm.
when you do it with a professional.
Hmm.
Yes, not
Like,
someone that trying to use you, yeah, or maybe some abuse, you know.
mhm. Right.
It is good to do it with a professional,
Okay, great. So, like,
with a
how
therapist.
how does hypnotherapy help a normal person? For example, if I want to improve my memory, okay, I want to
Mhm.
improve my capacity of learning something better. How can I use hypnotherapy for myself, for example?
First, you can learn self-hypnosis because
Hmm.
we have these too.
Okay.
Or you can simply take give help from a professional.
Hmm.
You go there and they help you to work on this specific subject.
Hmm.
You're trying to work on your memory. So for the first, we are in a relaxed level. We
Hmm.
we work on relaxability and
Hmm.
for being relaxed and our relaxation. Then working through it, and the suggestions are here.
Hmm.
And it is important to use specific word in a specific time. That's what can make change. We can use lots of words, but doesn't change anything in our mind.
Hmm.
But it is good to know when should I say what.
Hmm.
That's important in
Okay,
hypnotherapy.
that's great.
Yeah.
And for self-hypnosis, like you said, that one needs to know how to do self-hypnosis.
Mhm.
So, what is advice for self-hypnosis? Should that be like a recording or with some music, or it should be like, it's like a video that with some scenes or something? How that could work out?
It can be by recording something like that. It is great. We can do it right like this. But there is several methods. You can have a plan for it. First of all, you have to learn how to relax your body and your
Mhm.
tension and things like that. And then you should write down what you are trying to work on and what suggest do you need really.
Mhm.
Then before you start your hypnosis or self-hypnosis, you should just review them and read them, and then trying your focus and your relax, and then trying to start the suggestions and just review them in your mind. You don't need to remember all of those things that you wrote down.
Agree.
Just to review and trying to put yourself on those situation and see
Mhm.
you see yourself on those positions and things you want to achieve.
All right, great. So
Yes.
actually, my next question was related to addictions, like how
Mhm.
can you use hypnotherapy to get rid of our addictions or habits that we want to get rid of? Habits like, for
Mhm.
example, smoking. Some people have
Mhm.
smoking habits, or some people are
Yes.
not able to sleep, or some people
Yes.
are addicted to sugars too much, a lot of
Mhm.
sweets they want to eat all the time. So,
I
how
have to
how
add
can we
something
use?
about addiction. It is a good method for healing addiction with hypnotherapy, but it is to notice something that we cannot um, simply heal addiction with hypnotherapy. Maybe his body still needs his drug or uh, the the thing that he used for his brain. It's like let me remember the word. It was neurotransmitter. Yes,
Right.
maybe
Okay.
uh, it's dopamine or serotonin that he needs or she needs.
Correct.
It's coming with the drugs or smoking or things that he or she use. So we cannot simply just trying to um, delete this from his life. Maybe
Mhm.
he smoke because of something emotional or something in his mind or life. So still, maybe if he delete his smoking from his life, after that, his aggression come to him
Mhm.
and punish others. So this is very, I think
Tricky.
it should be, yeah, yeah, it's very, it's a big detail, I think, that we
Mhm.
can work on it. But
Right.
first, maybe it needs the medication or something like that. We can just do
Mhm.
it with therapy, in my opinion.
Right.
Maybe it
So
needs
basically,
medications.
like if we are talking about dealing with addictions, we need to find the root cause of that addiction first, and then we
Yes.
can, take someone in trance or in a hypnotic state, and then we provide them suggestions about it. That
Mhm.
slowly it would get off from their,
Yes.
neurological cycle, brain,
Yes.
and then it can be waved off,
Yes, of course.
right?
Yeah. Right.
Okay, so I will tell you something about the reason why I know that beta, alpha, theta, and delta state. In Silva method also, we coach people, we train people on how they can take themselves to alpha, theta, and not to alpha and theta states. Delta is not
Mhm.
something that we train people on, but how to take themselves to alpha state, how to take themselves to theta state. And because, as far as I know, theta brainwave frequency is the most suggestive frequency. Like, if you want to
Yes.
create an impression on the brain about
Yeah.
something, about self-confidence, about self-imagery, how you see yourself,
Mhm.
how you project yourself, what do you believe about yourself,
Mhm.
that's the best thing, what people can actually work on for themselves. So this is what
Yes.
I know about alpha and theta, and how to, use them for impressions and all. So
Yes.
like that's quite
Sure.
informative, actually, the information that you have given, especially related to the addictions and all. So like for ADHD and PTSD, that's
Mhm.
quite common nowadays. People are not able to focus. So can we use hypnotherapy for ADHD and PTSD also?
Yes, of course. And it is good for both, but I think it's better for PTSD, but it's related to the person. Suggestions are for one specific thing. This
Right.
is the difference.
So
Yes.
actually, my next question was related to addictions, like how
Mhm.
can we use hypnotherapy to get rid of our addictions or habits that we want to get rid of? Habits like, for
Mhm.
example, smoking. Some people have
Mhm.
smoking habits, or some people are not
Yes.
able to sleep, or some people
Yes.
are addicted to sugars too much, a lot of
Mhm.
sweets they want to eat all the time. So,
I
how,
have to
how
add
can we
something
use
about addiction. It is a good method for healing addiction with hypnotherapy, but it is to notice something that we cannot um, simply heal addiction with hypnotherapy. Maybe his body still needs his drug or
it?
the uh, the the thing that he used for his brain. It's like transmitter. Yes,
Right.
maybe
Okay.
if it's dopamine or serotonin that he needs or she needs,
Correct.
it's coming with the drugs or smoking or things that he or she use. So we cannot simply just trying to um, delete this from his life. Maybe
Mhm.
he smoke because of something emotional or something in his mind or life. So still, maybe if he delete his smoking from his life, after that, his aggression come to him
Mhm.
and punish others. So this is very, I think
Tricky.
it should be, yeah, yeah, it's very, it's a big detail, I think, that we
Mhm.
can work on it. But
Right.
First, maybe it needs the medication or something like that. We can just do
Mhm.
it with hypnotherapy, in my opinion.
Right.
Maybe it
So
needs
basically,
medications.
like if we are talking about dealing with addictions, we need to find the
Mm.
root cause of that addiction first, and then we
Yes.
can, take someone in trance or in a hypnotic state, and then we provide them suggestions about it. That
Mhm.
slowly it would get off from their,
Yes.
neurological cycle, neurological, brain,
Yes.
and then it can be waved off,
Yes, of course.
right?
Yeah. Right.
Okay, so I will tell you something about the reason why I know that beta, alpha, theta, and delta state. In Silva method also, we coach people, we train people on how they can take themselves to alpha, theta, and not to alpha and theta states. Delta is not
Mhm.
something that we train people on, but how to take themselves to alpha state, how to take themselves to theta state. And because, as far as I know, theta brainwave frequency is the most suggestive frequency. Like, if you want to
Yes.
create an impression on the brain about
Yeah.
something, about self-confidence, about self-imagery, how you see yourself,
Mhm.
how you project yourself, what do you believe about yourself,
Mhm.
that's the best thing, what people can actually work on for themselves. So this is
Yes.
what I know about alpha and theta, and how to, use them for impressions and all. So
Yes.
like that's quite
Sure.
informative, actually, the information that you have given, especially related to the addictions and all. So like for ADHD and PTSD, that's
Mhm.
quite common nowadays. People are not able to focus. So can we use hypnotherapy for ADHD and PTSD also?
Yes, of course. And it is good for both, but I think it's better for PTSD, but it's related to the person that has this specific illness. It's different from person to person. Somebody maybe use hypnotherapy about 15 courses and it gets better and better, but for someone maybe doesn't work.
Mhm.
But let's talk about hypnosis. We didn't talk about that. Some misconceptions. Come on,
Conception.
misconceptions. My daily life, I'm speaking Persian, but it's like
Yeah.
it's shifting. Yeah. Some misconceptions here. Let's talk about it. Um, Number one, is hypnosis a kind of sleep? As we spoke on it, no, it's not a kind of sleep. It's not even similar to sleep.
Mm-hmm.
Because when we are in hypnosis, we remember things after that. But when we sleep, no. We can wake up a person who is asleep. But when you are in a hypnotherapy, you are not asleep. We can even put some needle on your hand and you don't notice.
Mm-hmm.
But in sleep, no, awake.
You will be awake
Uh,
immediately.
yeah, of
Yeah.
course. Number two, only sick or weak people are hypnotizable. No, no, it
Mm-hmm.
isn't. Uh, I have to say, otherwise, people with a high IQ have a better state for hypnosis. It's
Mm-hmm.
not about weak or people with sickness that
Mm-hmm.
are better for hypnosis. No, people who are most clever are better for hypnosis. For me personally, I am four in Spiegel test in hypnosis.
Mm-hmm.
Because every hypnosis is self hypnosis. You first should hypnotize yourself.
Mm-hmm.
It doesn't work with you have any master. No, your master in hypnosis is you.
Right.
You give, yeah, suggestions from your brain. I allow myself to be in hypnosis, and then I am hypnotist. Number
Well,
three, is hypnosis dangerous? It can be.
mhm,
Yes, I don't say no, it's not dangerous because it can be if you don't work it if you don't um, do it with a professional or with a unsafe person. If you do
mhm.
it with an unsafe person, it
Right,
can be dangerous.
right.
But I can say no, it's not dangerous because your brain has it's like there is a person in your brain that if they suggest you something that you don't need, it can say no, I don't accept this, and we can wake us from our hypnosis. Is hypnosis magical? No, this is a myth.
Mhm.
It's not magical. It's not magic. Hypnosis is not magic. Some people say, is hypnosis new? No, it's not new. It's not a new method for healing.
Mhm.
It's so old. And there is something like, is hypnotizer can control you? As I said, no, it can control you unless you let people control you.
Mhm.
And it's not a mind control. Is it a trick or is it a game or is it a play? No, it's not. When we say hypnotherapy, it's about healing. It's about therapy. It's about doing something with your potential.
Right.
So it's not a game. It's
Mhm.
not a trick. Is it fun? It can be fun when you use it for audience, but it shouldn't be.
Right.
It is a healer.
Agree.
Yes. And yes, there was some several misconceptions, come on, why misconceptions? Come on, I don't know why it doesn't work on my tongue when I
Mhm.
say that. Or some people say, is it only for illnesses? No, it can be for achieve something, some goals. It
Mhm.
can be for athletes
Mhm.
for achieve a goal in your sport or in something that you want. So it's not only for people who are who has addiction or
Mhm.
they have illnesses. It
Right.
has lots of place that can do and we can use it for us.
Mhm.
And there is a lot of benefit in it.
Okay. Clear.
Yes. Yes. That's it. If we want to ask anything, I'm here. If we want, we can talk on the effectiveness of hypnotherapy. I already told you two
Yep.
of them: anxiety, stress, and pain.
Okay. Like Rizwan, one question I would say that
Yes.
for a normal person who is having some, problem of anxiety and depression, how many sessions of hypnotherapy is needed on average? I'm not saying some extreme cases, but on an average,
Uh,
for a normal person, how many sessions they will need to, to come out of it?
it's different person to person, but about 15, it's enough.
Okay.
15 course for this person, it's enough. Yeah.
15 sessions of hypnotherapy.
Once a week.
Okay.
Yeah.
Once a week should be enough for anyone suffering from anxiety, depression, and any kind
Yes.
of other stress.
Anxiety, it must work more on it. So it can be more than 15.
Mm-hmm.
But for some of them, it's enough, even seven course on it. It's enough. But for anxiety, it's more than 15. It takes time
Okay.
because
So,
yeah.
just one question I would like to hear. I would like to, ask you actually that what made you choose hypnotherapy as your major? What was the trigger for this interest? Why you got
For me,
interested in hypnotherapy. Yeah, why you got
for
interested.
me personally, okay, if I'm gonna say that, okay, first of all, I know, I'm a psychologist, and this is a method that it's like a surgery, and because we are not a doctor, but we don't use medications, we
Hmm.
don't use medicine, but it's something that we can use our power to healing ourselves.
Hmm.
Even there is some of my professors say that we heal cancer. We heal the cancer with hypnotherapy.
Right.
So that's why I think that we are very powerful, and I choose this to show people they are very powerful and they can use their potential to heal themselves
Hmm. Right.
and achieve things they want with their potential,
Hmm. Great.
not any things
Hmm.
from the environment or
Hmm.
anything from out. Our potential is in us. This is this is very really driving me into this subjects like um, um, spiritual things and things like that. But hypnotherapy is not spiritual, by the way.
Right.
Yeah, even
It's a pure
doctors use
practice.
it. Yeah, dentists can use on it, use hypnotherapy for their clients,
Yes.
for patients. Yeah, and without any uh,
Anesthesia.
anything. Yeah, yeah, they can use just hypnosis for their
I
clients.
know, and actually, I know one surgeon personally. I know him, and he performs that. He was telling me that he does hypnosis, and for his
Mhm.
surgeries, he he just takes his patients in that hypnotic state, and he performs the surgery, and they don't even bleed. You know,
Mhm.
and that was really
Yeah.
really interesting what he told me that day.
Yeah. This is very interesting, and somehow I think it's so magical that there is some power like this in ourselves through ourselves, but we don't use it.
Yeah.
We don't use it
Exactly.
the way
So,
it should be.
see, as I
Yeah.
see, it's more like, you start using your subconscious mind in a way
Yes.
that it entirely controls your physical body as
Correct.
well. And in
And belief
subconscious mind,
systems.
it gives you, that power to overcome any kind of functional things or any kind of problems that you might be facing, but it can control it immediately for you.
Yes, and hypnosis is exactly work on our unconscious mind, not conscious mind.
Right.
But some methods like CBT, it's directly work on conscious mind. What we believe, what we
Mhm.
think, and we ask things in their conscious,
Right.
not unconscious. When we go deeper and deeper in their hypnosis, so we can see things that we can't see when we are fully aware.
Right.
And there is another method, we call it CBH. It's
Hmm.
combine of CBT therapy with hypnosis. It's
Okay.
CBH. Yes, I
Okay.
know that. It is great. It is better than
Mhm.
CBT and hypnosis
Mhm.
when they are not combined.
Okay.
It is good. We can go for there and find the wrong beliefs
Hmm.
and the root of the problem
Hmm.
in their mind, in their beliefs, and what they think about it.
Okay. So you have brought something very interesting up here. So it's more like a limiting belief, basically, that you are
Yes.
talking of, which you can use in CBH. Okay, okay, Rizwan. So what I would like to ask you, you have mentioned something called CBH, right? A combination of
Mhm.
CBT and hypnotherapy. Can you give us some detail
Yes.
about it, how that works, and what are the steps basically that you as a practitioner perform on the subject? and how that can help people.
Yeah, it's not something that I can say in a very brief things, but it's working in when we are working on it, we can see what is happening. But if I want to say something about it, okay, let's see, A, B, C.
Mm-hmm.
Something happening to us, accident,
Mm-hmm.
something happening to us. But there is a C that we respond with something.
Mm-hmm.
And sorry, something accident happening to us.
Mm-hmm.
And when we ignore this something between these two, there is something that is happening in the end.
Okay.
But what is between those accident and the result?
Mm-hmm.
Our our beliefs. This is B. When something accident to us or something happening to us, there is something call it beliefs. What we believe about this accident.
Mm-hmm.
I put my water on my desk, but accidentally it dropped and I have no water or my glass broken.
Mm-hmm.
I can say, okay, that's nothing. It's okay. And I keep it here again, or
Mm-hmm.
maybe put it in a trash bin.
Mm-hmm.
But or maybe I can respond in different way. I say, oh, come on, today is it's the worst day of the world. And this is because of my bad luck. I could not go to my job and I change my, my action with my family and
Mm-hmm.
start a new problems. This is
Mm-hmm.
how it comes for us. Something happening and what we behavior in the response of the thing. This is important. CBT is going to say that when something is happening to you, what is your belief about it? What
Mm-hmm.
is your cognition about it?
Mm-hmm.
What do you think about it? And what do you act in the response of the thing? And why you do something?
Mm-hmm.
In CBH, trying to find why some people do some things
Mm-hmm.
and what should we change to not have this response.
Okay.
If I change what, I can have another response
Mm-hmm.
because accidents always happening to us. We
Right.
can't stop it,
Mm-hmm.
but
Right.
we can stop our brain and change it and find the root of it.
Right. Correct. And I mean, like you explained it very well, and it's quite easy to understand. So, what I understood from you, let me just repeat
Mhm,
it myself. So, it's like basically, if something happens to you, how your
mhm,
brain processes it based on your beliefs,
mhm.
based on your past experiences, and how you
Yes.
respond in the end
Mhm.
to the entire situation. That is
Yes.
something basically the belief system in the middle, or the past experiences, or the impressions on your subconscious. This is something that
Yes.
basically you would be treating through CPH, right? I got
Yes.
it correct, right?
Works on cognitions. But
Right.
when we have CBH, we work on cognitions through hypnosis.
Okay.
Yes, and
Mhm.
find the way have beneficial from
Mhm.
this
Right.
act to act more better and safer for ourselves, to find a better way acting or responding things that happening to us, and find the way why I speak like that with that person,
Mhm.
why that thing trigger me,
Right.
find the trigger,
Mhm.
find a way. Oh, come on, why I talked like this, why I walk like this,
Mhm.
that it caused me a lots of problem,
Right.
or why this problem is always happening to me. find the root of it,
Right.
working through it. And your therapist must ask you a lots of questions and support you to go in imaginations. And there is a method called imaginary.
Mm-hmm.
They can put you in some specific place in your brain or in your heart.
Mm-hmm.
You
Right.
can go to your body with imaginary,
Mm-hmm.
with red blood cell,
Right.
and go through yourself and
Mm-hmm.
find the problems, your
Mm-hmm.
pain, your act, your beliefs,
Mm-hmm.
and everything that you have. You can find that,
Okay.
and you are very deep in hypnosis.
Okay.
And I should say in CBH we don't just use hypnotherapy. We
Mm-hmm.
speak on things. We speak with person that what's your problem,
Mm-hmm.
what do you do for it, and so on, and some task we give him to
Mm-hmm.
do to
Right.
heal that. Yes.
Okay. And Rizwan, what's the family sessions for hypnotherapy? People talk about that EDMR, I believe. So how much that is different? It's like,
Beneficial for those who have it. For
mm-hmm.
athletes, as I said, they can imagine and find their cells to improve their power through hypnotherapy. I
Mm-hmm.
have a story. It was a story. I read a story that it was about a girl who was a professional ski on
Mm-hmm.
ice, a ski
Okay.
player on ice.
Mm-hmm.
She closed her eyes and just do like this and nothing, just focusing on herself and doing nothing. And there was a cameraman
Mm-hmm.
that he took his picture.
Mm-hmm.
And after the game and after the match, they see that girl was the winner.
Mm-hmm.
And then the cameraman asked him, "What will you do? I have a video from you. You
Mm-hmm.
close your eyes and just do it by yourself with your hand, and you are this dissociation from all over your
Mm-hmm.
environment." She laughed and said, "Yeah, I was on a self-hypnotized state and I was imagining all those roads, and I imagined and see myself, and I was tuning myself to achieve this goal as I do. And I even broke my record and
Mm-hmm.
I win myself even."
Right.
It just about their imaginations and self-hypnotize herself to achieve
Right.
this. And of course, there is too many like fatigue, hair pulling disorders, skin picking disorders, people with uh, pain or stress in
Mm-hmm.
performance disorders, who seeking for enhancing memory and
Right.
focus, people who dealing with OCD, as we know, obsessive
Mm-hmm.
compulsive disorder. We can
Right.
work on this too, because as I know, OCD is some anxiety.
Right.
OCD is anxiety, and we can heal it through hypnosis too. And individuals with cancer, that we can help them on psychological and emotional challenges
Mm-hmm.
in their diagnosis.
Right.
And tensions, headaches, growth, loneliness, and habitual behaviors,
Mm-hmm.
that we can work on it. Motivation, increase motivations through hypnosis,
Right.
and so many, but not all the disease.
Mm-hmm.
It is good for some of them. It is better for some of them, but uh, it's different from person to person.
Okay. Great. Thanks for the detailed answer. So, for all our viewers, like if you need to book a session with Rizwan, just drop a message to Core Cognitive. We have a form there, and you can just drop in the details there so we can arrange a session for you. And from there, you can take it up, like how many practical sessions you need, or it is just like a consultation that you benefit from Rezvan because she has deep knowledge about hypnosis, psychotherapy, and multiple other healing techniques as well. So thank you everyone for watching us. Thank you, Rezvan, for being with us today.
Thank you. Thank you for having me. And thanks for your audience that they are watching us. Thank you.